Thank you, Mr. Speaker. I rise not as a member of Congress, but as a doctor. When I graduated medical school and took that oath, there are two core ethics that we take when we take that oath: to do good. And that's exactly what we tried to do when this body passed the Affordable Care Act. It was about doing good. It was about giving people basic access to health care. That is a good thing. Now, the Affordable Care Act's not perfect, but let's keep doing good. Let's fix it. Let's address the cost of health care. Let's make sure people can afford their medications. But that's doing good. Now, another core ethic that we take when we enter the profession of medicine as a physician is to do no harm. Now, if this body repeals the Affordable Care Act, we are going to harm 20 million Americans that now have access to health care that didn't have it prior to the Affordable Care Act. We shouldn't do harm. Now, let me put it into real context. I'm a primary care internist. My wife is also a primary care internist. Now, you can tell we have exciting conversation at our house, but I was asking her the other day what the Affordable Care Act meant to her as a physician. And she was sharing a story of a patient that she had cared for years. This was a patient that had diabetes and hypertension, high blood pressure. Now, we know these are silent killers. If you don't control your diabetes, if you don't control your blood pressure, it can have devastating consequences, leading to heart attacks, leading to strokes. It's one of the leading causes of death in America. But if you control it, you can prevent all of these illnesses, and people can live a normal, healthy life. So my wife, she's a very good doctor, had her patient under good control. Well, the patient, stopped coming in to see her. She thought maybe the patient moved away, something happened for a couple years. And then, about 2 years ago, the patient came back in. When she came in, her blood sugars, her diabetes was out of control. Her blood pressure was out of control. And my wife looked at this patient and just said, well, what happened? How come you stopped taking your diabetes medicine? How come you stopped taking your blood pressure medicine? She said, well, doc, in the recession, I lost my job. I lost my health insurance coverage. I couldn't get the medications. And then she said, but you know what? With the Affordable Care Act, with Covered California, I was able to get health insurance again. I was able to come in and see you. Now, it wasn't too late for this patient. My wife was able to get her back on her medications, get her back on her blood pressure medicine, get her blood pressure and diabetes under control, and hopefully there's no permanent damage. But if we do harm and repeal the Affordable Care Act, we are going to do irreparable damage to 20 million and more Americans who are just like this patient, who need their health care covered, who need their access to medications. That's what this is about. So, Mr. Speaker, let's do what we're trained to do as physicians and what this body should do. Let's do good by making sure people have better coverage, affordable coverage, and better access to health care. And let's definitely make sure we do not do any harm by repealing the Affordable Care Act. Let's make sure we fix it better.